Hey everybody, talking a little bit more about recovering after surgery for subungual exostosis. Because these are a minimally invasive procedure in the way that I undertake them, you can weight bear immediately in a post-operative shoe. This is meaning that you can get back to your work sitting at around that 3 days. Once we take off the initial dressings, that can make it a little bit easier, but I do ask my patients to put their feet up initially because there's not much venous or lymphatic return from the toe, and so of course it is going to get a little bit swollen. We don't want it to get too swollen. And because of that, patients I typically don't recommend, if they're getting back to a standing job or a higher impact job, that they're not doing that till about 2 to 3 weeks, where at most, if there is a stitch, then that's going to be removed by that stage as well. Most of my patients are back into their joggers really early on with this type of procedure, again because it is minimally invasive, and so do consider whether that's going to be the best option, or one of these procedures may be the best option for you or your patients. Back to walking for leisure and your sports is around that 2 to 4 weeks. Again, people recover really quickly, and so it's about putting this into place, reducing that pain, and then getting them back on their feet as soon as we can. But if you've got any patients that are asking a few of these questions, hopefully this has answered some of the questions that you are having yourself, having for your patients, and going from there. But if you liked what you've seen in this video, hit the subscribe button, have a bit of a look at some of our other videos, leave any comments down below if you've got any, and we'll talk to you in the next session. Cheers.